Did you know even a cruise dose of 150 tests can push hematocrit past 54%, raising stroke risk by 60%? So is this really recovery or just a fast track to Strokeville? And that's just one of 15 unbelievable steroid myths that I've got to show you. Like, is a test-only cycle the safest approach? Can perfect blood work lead to permanent damage? And is the gear you trust the one costing progress? Now, let's kick things off with myth 1. How guys like to lower the dose after a blast, so they let the body repair itself. Well, quantitative findings saw men on low-dose TRT having double the cardiac risk after 10 years. And they felt totally fine the whole time. TRT can mask imbalances between hemoglobin, hematocrit, and red blood count. You might have normal hematocrit, but if red blood count and hemoglobin are out of proportion, that's a silent signal for thick blood, poor oxygen delivery, and rising cardiovascular risk. Most clinics do not check the ratio mismatch, and that's where the serious damage lies. So is cruising really recovery? Low-dose coasting hides symptoms. It doesn't fix the system because recovery is not passive. Hyperlactin lowers dopamine, libido, and motivation. That won't drop on its own. A short run of Kava might be needed. Crash thyroid from long-term gear use. T4 or a low balanced dose of T3 could be needed to restart the engine. Low hemoglobin with high hematocrit, that's that hidden mismatch. B12, iron, maybe copper, depending on labs, could be needed. So generally a small dose will not fix the issue. It just delays it until the start of the next cycle, lights it back up again. Now the second myth. When you're on gear, you need to train twice as hard. The second that enhancement injection goes in, guys go from training 4 times a week up to over 6. Double sessions and maxing out all volume and intensity. Why is that? Recovery is faster on gear, isn't it? But here's the thing, enhanced recovery is real, just not unlimited. Studies show 30 to 50% faster recovery in enhanced athletes. That's meaningful, but not licensed for overkill. Inflammation markers like CRP on IL-6, they will spike with chronic overtraining, even on steroids. Plus, longitudinal lifting data shows size and strength gains plateau when training exceeds recovery capacity. Again, regardless of the PEDs. So should you be doing more? This is in fact half true. You can train more, but only if recovery keeps up. Otherwise, you're just digging a deeper hole. On to myth 3. Test-only cycles are a safe bet. Stick to testosterone. No stacking, fewer problems. One guy can be on 250 a week and coast fine with perfect labs. Another guy, acne, insomnia, high blood pressure, sky-high estrogen. Genetics and starting labs set the rules for the following: aromatase activity, SHBG, liver clearance, and many other things, all widely different across users. And a 2020 study showed up to a 6x in variation when looking at estrogen conversion between men on the same dose. Some can thrive on 200 tests, while others crash on 125. There seems to be no safe dose without context. Therefore, simple does not mean safe. The testosterone still needs to match the biology, and even mild dosing can be chaos without the correct monitoring. Did you know estradiol below 20 picograms on TRT cuts muscle growth in half, balances everything, even on a clean cycle? Brace yourself. Myth 4. Test builds muscle without even training. You still need to go to the gym to grow, right? Well, published literature has found hitting 600 tests a week, subjects gained 7 pounds of lean mass in just 10 weeks. And that was all without lifting a finger. Yes, test alone builds muscle, but recognize training turns that into real strength, shape, and function. Next up, number 5. Steroids fix low motivation. The more tests we have, the bigger the drive. Looking at current findings will indicate gear does boost recovery, energy production, and aggression, and that will make guys train more often. But let's remember, it's just a neurochemical high. So when sleep crashes, dopamine burns out, stress builds, that drive vanishes. Steroids spark motivation, but if the system's off, they won't sustain it, because real drive comes from balance, not just androgens. And now 6. The more steroids, the more muscle. If 500 tests builds mass, then 1,000, that should double it. Yet, muscle protein synthesis starts to plateau around 700 to 750 tests. Above that, blood pressure, cortisol, inflammation all spike. Liver and kidney stress increase, and those side effects rise faster than muscle quality. So does that mean more is always better? After a certain point, it's not growth, it's just damage control. Did you know CRP, a key inflammation marker, can double at higher dosages, while muscle gains barely even budge? Myth 7. Aromatase inhibitor is estrogen control. Just taking an AI from the start and the estrogen sorted. Not exactly. Here's the data. A 2021 study showed AI overuse dropped HDL by 30% and reduced strength in trained men. So when estrogen crashes below 20 picograms, you get joint pain, mood swings, trash lipids, slower muscle growth, and that's just the start. Estrogen blunts IGF-1 and spikes cortisol. So before they've built anything, they've already crippled recovery, stress resilience, and anabolic signaling. Controlling estrogen is not about nuking it, it's about balance. Let's examine myth 8. Lower dose means lower risk. Doing 125 tests a week, it's not going to hurt anyone. Yet in practice, 1 in 5 users hit stage 1 hypertension in under 6 weeks just on 125 tests. There was a 2020 case study that saw TSH and T3 be suppressed at just 150 tests, and that was without an AI. So is a low dose always safer? Minimal mgs does not guarantee less risk. It's your body's reaction, and that can all be seen in monthly blood work. Gents, who's heard a steroid myth that sounds a bit off? Drop it below and let's clear up the science. Here we go, myth 9. Orals damage lipids in under 7 days. You've got time to fix the lipids later, just do a short burst and you'll be good. Okay, well there was a study on Anavar where participants did 20 mg a day, and that showed a 40 to 50% drop in HDL within 6 days. And Dianabol, 30 mg a day, increased liver enzymes ALT and AST by over 200% in healthy subjects within a week. Post-cycle bloods often show lingering damage, and those lipid profiles will take 4 to 6 weeks to recover. This one is true. The liver does not care how short your cycle is. Orals hit hard and fast, and the damage can show up before the mirror even blinks. This is myth 10. TRT is always safe. If it's prescribed, it must be risk-free. Sounds good on paper, yeah, and we know clinics will push out 200 to 250 milligrams a week, twice the medical range, and 0 follow-up after the first month. They also like to throw in an AI by default, even if estrogen is fine. Patients are rarely told that this is not therapy. It's the start of a mini cycle. And by the time they do get around to reviewing the labs, the crash has already hit. So is clinic-backed TRT always safe? It can be, but not when it's copy-pasted, rushed, or misrepresented. A true replacement is closer to 80 to 120 a week. Anything above that will feel good short term. But without a real strategy, it's just a blast with no exit plan. Moving on to myth 11. If you feel fine, you are fine. I've got no symptoms and I think everything is working great. With that, here's what to keep in mind. High blood pressure rarely causes symptoms until it causes a stroke. Liver enzymes can triple without any warning signs. Low thyroid function, over-the-range prolactin, sky-high hematocrit often all go unnoticed until they wreck your progress or your health. Blood work does not lie, but feelings can. Ready for myth 12? You need 2 grams of protein per pound on cycle. Enhanced means more protein, obviously. In clinical settings, anabolic steroids increase nitrogen retention by about 15 to 25%, not 100. And research does support 1.2 to 1.6 grams per pound, not 2. Overconsumption of protein will strain kidneys, digestion, and slow recovery. More is not better, smarter is, as the body will turn excess protein into glucose, not gains. So it's better to put the carbs up to grow instead of maxing out protein. Now myth 13. A trusted source is safe gear. If it's from a clinic or a trusted guy, it must be clean. Still, here's what's been found. 25 to 30% of UGL gear is underdosed or worse, mislabeled. Even clinic source compounds have been shown to be diluted in independent tests. So does the source make it all safe? Trust cannot check what's in the vial, the lab does. Sometimes legit looking packaging means nothing, and even providers cut corners. Next up, myth 14. Clean blood work means you are fine. If the labs come back normal, you've got nothing to worry about. Still, outcomes do vary. Most panels will skip key markers like prolactin, ferritin, homocysteine, cystatin C, cortisol. Some guys just check total test, cholesterol, PSA, and call it all good. Blood work is like the weather. It's time sensitive. So a clean result from last month or a few months ago unfortunately means nothing today. The worst part is though, not everything shows up in the blood work. DHN, which is an androgen metabolite, if you're on DECA or MPP, can crush motivation, libido, and mental clarity without touching a single lab result. DECA is worse than MPP for that. Blood work is only useful if you check the right markers at the right time and you pair it up to how you actually feel. Revealing myth 15. Blasting in a PCT afterwards is safer than just staying on. Come off, do a proper PCT, and you're safe. We do have recent studies to support blasting 500 to 1,000 a week wrecks HDL, spikes blood pressure, shuts you down, and a PCT will slam your body with SERMs, but doesn't undo the damage. Many never return to a baseline of health, even after they do multiple PCTs. And research shows cycling causes more hormonal chaos than a monitored cruise. Blasting gear and coming off is not automatically safer. It's just untracked chaos in disguise. And real recovery isn't about just having time off. It's about blood work, balance, and keeping the system stable all year long. So if you think you might need some help and guidance to avoid playing Mythbusters with your health, you can reach out. In the description box below this video, there's a link. Hit that link and I'll get back to you as quick as I can. Next video, growth hormone tutorial. This is Dr. James, and I'm out.